Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by anybody.
So I welcome everybody again for the session tonight, and it's immediately after Holi. So everybody, I hope you enjoyed a really nice Holi, and I hope you all also utilize the sale, which is still going on the occasion of Holi. I usually take out sales when there is some festive season for my students, especially for the ones who are about to take their exams. Yes, and one very important announcement. Many of you want me to take a class on specimens. I've got a huge list from all of you. I'm preparing the class for that. And very soon I'll be announcing the class on specimens. So please watch out in my Telegram channel. Everybody who's there in the class right now, I'm sure all of you are there in the Telegram channel as well. Make sure that you unmute, okay, the updates for Telegram channel so that you're able to get all the notifications the moment I announce them. The Telegram channel is hardly ever utilized for just ads alone. Either it's an announcement of the class, or it's an announcement for the sale, or it's an announcement for your exams, upcoming exams, or any notifications from the DNB direct. For other reasons, when you want to chat with your friends to know whether the admit card has been received or not, whether the dates have come or not, anything which is very specific for the examinations, how the schedule is, or the podcast of the successful candidates, that is, everything is put on the Telegram channel, which is the chat section, or the chat room, for everybody to see. Okay, so there are many podcasts that by the old students which I have taken, which they've been good enough to send me regarding how their exams went, what is the protocol, and how the the setting of the exams is, especially the practicals. Everybody knows about the theory, but practical, how it goes on, the short cases, long cases, how much time you get to prepare, how much time you get to take the history, how you have to present, how many table vivas. Okay, and what is OSCE's pattern like, right? So one thing which was left was specimens, and I'll be taking them very soon. So let's start with our session tonight. So first question, yeah, by the way, this paper of DNB diploma was rather easy as compared to the paper 1. Remember, they were very tricky. Some of the questions were very tricky in the paper 1, which I was almost similar to paper 4 for the regular candidates. But this one was rather easy. So yes, enumerate. Now listen to the language very carefully. Do not end up spending a lot of time on questions like this, okay? The first question says, enumerate the causes of liver disease in pregnancy. Simple. Now, if I would be at your place, I will write down pregnancy-specific liver diseases like intrahepatic cholestasis, HELP syndrome, AFLP, acute fatty liver pregnancy, hyperemesis gravidarum can cause liver disorders. Preeclampsia-related liver dysfunction is a known thing, right? So this is pregnancy-specific. Then pre-existing liver dysfunctions like hepatitis, all kinds of hepatitis, autoimmune hepatitis, cirrhosis or portal hypertension, non-alcoholic fatty disease, very important, drug-induced hepatotoxicity, already there. Antitubercular drugs, notorious. Antiepileptics, notorious for LFTs, right? Deranged LFTs. Guys, please be on mute, everyone. Huh? Right. Then this was the enumeration. If you write one line each also, but towards the end of the exam, you will get maybe, instead of maybe 3.5, you'll get 4 marks. Or 4.5 marks. That's it. But if somebody has enumerated all these causes, I think I'll give her a 4. Okay, and if you've written one line each, maybe 4.5. So just for 0.5 marks, I don't think you should be spending a lot of time. Just enumerate, cut, and leave one line for all the points. Suppose you get time towards the end, you can only kind of increase 0.5 marks more by writing one line each. Even if you enumerate, your job here is done. So remember that you have to write down the causes. That's it. No management, no differential diagnosis. No investigations, nothing. Enumerate pregnancy specific and just pre-existing. All right. Then, how will you manage an HSV antigen positive woman? Now just look at the headings. Always, whenever management starts, it starts from the history. So you confirm the hepatitis B status. You see how infective this patient is by doing HBe antigen, HBV DNA levels, and check the liver function test when she comes to you. Screen for any co-infections. Usually with hepatitis B positive, she can also have hepatitis C positive or D positive. So you will always check, right, for any co-infections. You will screen. You will involve the multidisciplinary team. You will assess a need for antiviral therapy. The multidisciplinary team, that is a hepatologist, they'll be able to decide this thing. So HBV DNA load, whatever it comes, like if it's more than 2 lakhs, she'll be asked to take antiviral therapy like tenofovir is now preferred in the 2nd or 3rd trimester. It is actually a safe drug. Remaining all others are not so safe in pregnancy. So tenofovir is nowadays preferred in 2nd and 3rd trimester only, not in the 1st trimester. If it's a low dose, basically she's been monitored and being handled over symptomatically. Antenatal care, of course, you have to have regular visits, you have to go regular liver function test, keep checking on the HBV DNA, monitor LFTs every trimester if required, every monthly, repeat the HBV DNA at 28 to 32 weeks if it's high risk. And of course, you have to, whenever you have an invasive procedure, be very, very sure of the HBV DNA load. Make sure that the patient knows, the person who's doing amniocentesis knows, and MDT has to give clearance for this. Okay. Then intrapartum management, you have this kind of patient, has PPH mostly. So make sure that her coagulation profile is in check. She has adequate blood arranged. Her hemoglobin is in shape. And otherwise, of course, you can go in for a normal vaginal delivery. No problem for that. If required, antivirals can be given. You have to check again the HBV DNA viral load again at 28 to 32 weeks, because here now the risk of transmission suddenly increases. Make sure that the neonatologist is in the loop. So when the baby is born, within 12 hours of birth, the baby gets immediate immunization, because vertical transmission rate is very high with hepatitis, right? So hepatitis B vaccine, the baby will get, and also the baby will get HBIG, which is the immunoglobulin. Okay, and the breastfeeding is dose safe. It's only usually contraindicated with HIV or if you have active lesions in chickenpox. Otherwise, there is no way in which you will not allow breastfeeding. So breastfeeding is safe as long as the baby has received both HBV vaccine and HBIG. Of course, postpartum follow-up will be with the neonate different and with the mother different. Okay, so the mother is going to get her antibody levels checked, and the baby is going to get the vaccination 0, 1, and 6 months, and check baby's antigen as well as antibodies once again at 9 to 12 months to confirm that the baby is immune. All right. This is one table which will give you what I could not, give you in so many slides. This one table will tell you how to go in early pregnancy, antenatal, late pregnancy, delivery, and postpartum. Okay, so if you don't have time to read so many slides, just go for reading the last table.